Hey, this is to help the folks out there shop for an updated Medicare health plan, as they call it on Medicare.gov, or also known as a Medicare Advantage Plan. And in your Medicare and You handbook, it will look like this, like a network-based HMO, PPO, MSA, HMO, MSA, network-based health insurance plan for you. And so if you've chosen the optional alternative, which is Medicare Advantage, then you are in a network-based plan, and you're usually using one ID card for your healthcare services, and going to your doctor's office and going to the pharmacy. One card, just like when you're on group health insurance. But if you've chosen this low-cost plan, you definitely want to look into the details, because the plan details are very important to know what your out-of-pocket risk is. So there is a max out-of-pocket for each one of these health plans, in network, and guess what? Out of network. And some of them are very restrictive in nature, and if you step outside of that small network-based HMO plan, which is an MSA or just a local HMO, then you might be susceptible to limitless out-of-pocket for out-of-network services, especially if you go, to a hospital that's not in network. So let's get back to it and how to actually do it on Medicare.gov, or better yet, if you have a family member who's computer or internet savvy, then they can help you along with this tutorial. But if you really need someone, guess what? You can actually talk to 1-800-MEDICARE, or you can click here, talk to someone. But I advise this for you to call 1-800-MEDICARE late at night. And here's a tip. Make sure you say agent 2 to 3 times while you hear the voice prompt, and that will get you to a live Medicare agent call center in your region, in your area. So make sure you do that when you hear the voice prompt. So from here, if you're brand new to Medicare, you'll need to create a login and create an account, and that can easily be done after you enroll into Medicare Part A and B through Social Security, and that's done through SSA.gov, and that's where you apply for Medicare Part A and B. Once you're done with that, you have your account, you're enrolled in Part A and B, then you can go down here and click Find Plans. I'm going to scroll up so you can see it. Find Plans, or you can actually go up here and get Find Health and Drug Plans. But it's the same exact page that it lands on. So just click on here, and then look at this. Find a Medicare plan. So a Medicare plan means a Medicare Advantage plan. So Medicare.gov is able to shop the Medicare plans throughout the U.S. in your area, because they all have a service area that they're attached to, a service area of doctors and hospitals that these Medicare Advantage plans are attached to. And guess what? Since Medicare is the administrator for all Part D drug plans, whether they're standalone or whether they're included in Medicare Advantage, you can also shop that in your MyMedicare.gov account. So creating one is very, very beneficial, not only if you are on a Medicare Advantage plan, a Part D drug plan, but also too, if you're on original Medicare, you get to see your EMSN, your electronic Medicare summary notice claims from your providers from all your providers that you have used within the last 24 hours. So this is very important for all Medicare beneficiaries to create an account, and you be able to log in and keep your information up to date, and make sure to keep it safe, because the scammers are working harder than before during COVID, and they've been highly successful to get your identification and information and private information from you. So I'm going to log in without using a account, because if you have a loved one or a friend or somebody you trust, they can actually help you look into these plans, because they're allowed to help you research some of the information with you while you're there. So you'll just click on Medicare Advantage Plan, because that's what happens when you're shopping for a Medicare health plan, Medicare Part C, optional alternative health plan. And so from here, you'll click there. You'll just type in your zip code. I'm just going to type one here, the local one in Charleston. And then, do you get help with your costs from one of these programs? So if you've gone through Social Security Administration, your local one, or called in, then you know if you'd be able to qualify for any of these programs based upon your income, based upon your limited resources. And that is definitely something that you want to look into, especially if you have a need to get help with some of the Medicare costs and cost sharing. So for this particular case, I'm going to say no. And then from here, tell us your search preferences. Do you want to see your drug costs when you compare plans? Most people would say yes. After you log in, guess what? It will automatically put their drug medication or your drug names on the file. So I'm just going to put a common one here, like a high cholesterol. I'm going to add that, and then you add to my drug list. And if you are on your Medicare.gov account, this would actually stay on your drug list until you edit or make changes to your drug list in your Medicare.gov account. So it's very similar to this. And I'm just going to put another one here, amlodipine. Amlodipine, there we go. And then from there, I'll just stick to 2 right now, but you guys get the idea. You put in your medications and then you say you're done. And then from there, it's very easy to make sure that your pharmacy is in the formulary within the preferred vendor list for that actual drug plan or the Medicare Advantage plan with drug coverage in it. So I typically like to go out to 5 miles if you're in a densely populated area, or if you're a rural area, you should go to the 25-mile distance and apply it. So I'm just going to click 5, and then from here, or you can type in the name of your pharmacy, but I'm always going to do mail order, because some mail order pharmacy have, or some mail order pharmacies that are attached to these drug plans are showing lower cost and cost sharing for the beneficiaries, but you always want to compare. So from here, you'll just use whatever pharmacy that you're close to, or that has is a preferred vendor, and that's something that you want to check if they're a preferred vendor. And I'm just going to do one more, and you can do up to 5. And I'm just going to do make sure that this one is showing, oh yeah, Publix. There we go. And then I'm done. So I click done, and then I'm loading. And then from here, you get to see all the different plans. It's saying it's showing 10 out of the 39 Medicare Advantage plans for 2021. Now, I know some of you have already done this and know how to do this yourselves, but I want you to compare and show this video to someone who just needs a little extra time to review how this is done and what is best for them, because it really is ultimately a Medicare journey, and every change that you make is sometimes potentially a big one. So if you look at all the different plans, obviously it goes from lowest, it's going to go lowest drug cost to premium cost to the highest for this filter. And then from here, you just look at the different brands. Now, I know the star ratings, some people rave about that, but majority of these plans have the almost the same exact star rating. So it doesn't really reflect the experience of the Medicare beneficiary, and it doesn't really compare what's truly matters to you when you're using the plan is coverage. So you want to look at the coverage, and you want to look at what the cost sharing is when you use it for specific covered costs. All right, so as you can see, the max out of pocket is for in-network and out-of-network changes a good bit. So look at this. Some of the lower ones is $5,900 for in-network, and then That's a HMO PSO. Looks at this one, 6,100, 11,300 in and out of network. I don't know what that why that would be an advantage, but here we go. Let's just go through something that's similar, right? So we're just going to compare a little side by side from the 2021 to the 2022. So this one is the same brand WellCare as this old one, and this is on Medicare.gov from 2021. As you can see here, the premium is 0 from this older one. And a lot of people know that the Part B premium for 2021 is lower than the 2022. It has raised up to $170.10, and you got the 5.9% cost of living increase for 2022. And so that is helped out by paying the Part B premium, hopefully for you. And then from here, you're going to compare, okay, what's my max out of pocket for in-network? And let's look at the max out of pocket for the plan on Medicare.gov. So all you do from here is look at the plan details, and I'm just going to shrink it just a little bit so I know you guys can see, but I'm going to shrink it a little bit. So just look at the plan details, and then from there, let's make sure everything's the same. Let's do a little bit of side by side. So this is where you click on, not just click on the benefits and costs, but you're also just going to scroll down to compare. So let's see, Part B premium 170.10. Let's see, Part B premium from last year, and we all know that's something that we can't adjust. That's set by the federal government every November, and so there's always a little bit of adjustment there. So it's 148.50. Let's go back here. Let's go back. The drug deductible is 100. Let's make sure if that's the same. And you're trying to compare as close as you can, apples to apples, but there is no one plan that is the same as the plan before, because these are not standardized plans. Like if you are on, say, for instance, a Medicare supplement plan, a Medigap insurance policy, those are standardized by Medigap protection laws and by the state's Department of Insurance and Finance for each and every state. So Medicare Advantage plans are not standardized. So I'm doing the best possible and similar comparison that I can for similar brand in front of you to give you an idea of how to look at it. Alright, so from here you've looked at the drug deductible. It's the same, and then this one has a yearly annual cost because of the more medications. But then let's go down to the actual medical services, the benefits and costs. Let's go down to benefits and costs, and you'll see the same thing, diagnostic testing and procedures. Let's go to diagnostic testing and procedures here. Look, so primary doctor 0 copay, $50 copay out of network, right? Specialist visit, $40 copay, $50 copay, and the diagnostic testing again, $0 to $50 copay. And then look at this out of network, 40% coinsurance, 40% coinsurance, which means that is that could be something that you're not expecting when you're out of network. So make sure that your diagnostic tests and procedures are in network, because your doctor can be in network, but the diagnostic testing and procedures can be done through a lab that's out of network. So make sure you understand that when you're on these plans. And look, it has gone up a little bit. Look, out of network. If it's out of network, it was covered at 30% the year before. So maybe a little bit of a better bump in coverage. Only 10% though, but make sure it's covered. So then from here, coinsurance 40% MRI. So in network, so for an MRI, that's typically where it would be a bigger copay for you. So up to $225. Again, $225. All right, good stuff there. 40%. So everything's looking a little bit better on the 2022 plan. Let's see, emergency care, $90 copay, and then $30 copay. So everything's looking the same. Now this is where the rubber meets the road. So this is the older one, in-network inpatient hospital coverage. Look at this. Day 1 through 5, you have to pay $300 per day for this older plan. And then let's go here, and it's gone up again, $350 per day. Now I know that's only a little bump in cost sharing, but that $50, if you stay for 5 more days, let's do the math here, right, times 5 days, and on average people stay in the hospital on average 5.6 days. I know that 0.6 is not a full day, but let's just say 5 days. So that's an extra $250 that you need to spend if you're in the hospital and on the newer plan. So the older plan protects you a little bit more than the newer plan. So let's go. So $0 days for days 6 through 90. And again, this is typically, you know what this is? This adds up to the hospital deductible for 2022, and that's why you see a little bit a little jump in price there for cost sharing. All right, from here, let me see. From here, you go to outpatient, and it goes from $225 to $250 copay. $225, $250 copay per visit, and 30% coinsurance per visit out of network. All right, and then let's go to the next one. So again, there's 40% coinsurance per visit. So a little bit of a bump in an increase in the out of network coinsurance, but that could be pretty expensive if you step outside of network. As you can see, 60% of, say, you get a hospital bill, even if it's an inpatient or outpatient, and it's, say, anywhere from $7, $10, $12, $15, $20,000. If you have to pay 60% of the coinsurance, that's a pretty big number. Okay, so that's something where you'd want to look into, say, an affordable hospital indemnity plan on top of this Medicare Advantage plan, or you can go the traditional Medicare route, and Medigap plans include the coinsurance, because Medigap plans cover the 20% gap that Medicare A and B does not cover. So if you have questions about the hospital coverage, make sure to comment below or contact us at MEDICARESAVINGS.us. All right, so in skilled nursing, you go down to skilled nursing, and this is, remember, I'm going from the old plan to the newer plan, and you can do this during the Medicare Advantage Open Enrollment period going on right now. It's started January 1st, 2022, goes all the way to March 31st, 2022. And so you can look at this information during that time and then see if this helps you with getting better coverage for yourself. And also, if you don't want to do this yourself, you want to advocate, you can always call in to Medicare Savings, so that way we can give you a little more insight and give you a personalized video like this, so that way you understand where your risks are, because these are Medicare Advantage plans, and they used to be called Medicare Risks plans, because the insurance company takes on the risk, and so does the beneficiary. All right, here we go. So ambulance, okay, so let's go here. Let's go to ground ambulance. And so the copay for an ambulance in network is $250, out of network is $250. Let's see if that's going up. Okay, ground ambulance $250. Ground ambulance, yep, same thing, $250. So that's good. Let's go to occupational therapy. Okay, in network $40 copay, and then out of network $40 or 40% coinsurance. And so occupational therapy, look at this. So now it went from just a regular dollar amount, $40 copay, to $50 copay for occupational therapy. So that 40%, I don't know exactly what that would be in terms of a medical claim, or how high that would be, but you'd have to pay the 60% gap on the out of network for the occupational therapy visit. Okay, physical therapy, speech, language therapy, and visit in network is $40 copay, $50 copay, $40 copay, now 40% coinsurance. Again, I do not know the numbers on the 60% gap for the physical therapy, speech, language therapy visit. So if you guys know what that medical claim would cost about to go to one of those providers, then please let me know in the comments below. Okay, so wrapping up just a little bit more, y'all. I know this is kind of dry, but this is exactly what a service like an independent insurance brokerage would do for you, is to actually compare as easily as possible what the similarities are and what the differences are from your old plan to your new plan. And just a quick fact, 88% of Medicare beneficiaries did not shop their plans last year. And so many folks did not shop their drug plans that went up, $40, $50, $60 per month in premium. They didn't shop their Medicare Advantage plans that went up. And so if you're in that situation and you're fairly in good health, or in good health, then you want to know if you are making sure that you can save some of your hard-earned dollars, or make sure that your plan is good for another year for you, right? Okay, so if you go down to durable medical equipment, look, in network 20% coinsurance, 20% coinsurance, and this is where it can get pretty expensive. In network is the per item. So it can get pretty expensive for durable medical equipment. And let me see, let's go to durable. I don't think it'll more benefits and costs. So let's go to so look at this. It all has copays, and then let me go to durable medical. So look, 20%. So once it starts saying coinsurance, your guess is as good as mine on the actual dollar amount that would be when it goes to comparing coinsurance. So it'd be 20% to 35% on the old one. It's 20% for, looks like, across the board for durable medical equipment, prosthetics, dialysis, and diabetic supplies. So that's, and look, zero copay for diabetic supplies. So 20% coinsurance. And I would say in my book, this would be a little bit more in favor of the older plan. The newer plan, because you're lacking out of the percentage in out-of-network coverage coinsurance there. So look, 35% per item, and this is 20% per item, right? So a little bit less. And so you have a little bit more benefit on the newer plan, and then it gets down to the drug coverage. Now here's the thing with the drug coverage. You want to make sure that your pharmacy is a preferred in-network pharmacy. So a standard one's great, but make sure that it's preferred in-network, and that way you're getting the lowest cost. And it does a breakdown for you. Obviously you can do this side by side with someone, but why waste your time if your job isn't to do this day in and day out? But we can do this for you, with you, however you want. If you call MEDICARESAVINGS.us, and all you got to do is type in into any search bar Medicare Savings, and will pop up just like this. But I highly advise you guys to click on the contact us over here to the top right, and that's me right there with my team, and we're able to take a lot of folks to be able to help them analyze and get a clear perspective on where they're at on their Medicare journey, because we help a lot of folks that just want to be, have someone they know and trust alongside with them to on their Medicare journey. A lot of this is not so exciting reading, but if you answer just a few quick questions, we can help you save not just now, or if we can't help you now, if you don't need our help now, we can help you in the future. So get in touch with us. You're more than welcome to look us up on all the search engines or Google Maps or whatever out there, and make sure that you get in touch with someone that's an advocate for your Medicare journey. I hope this video has helped. I'm not going to go through the rest of the comparison here, because obviously this goes into drug costs and everything like that. But if you have questions about that, we analyze Part D drug plans and Part D drug plans included in Medicare Advantage plans October 15th through December 7th. So we no longer can do that for beneficiaries that already have a drug plan. But if you are looking to switch back from Medicare Advantage to original Medicare, then that's when we are able to help you during the Medicare Advantage open enrollment period from January 1st through March 31st, if you're looking to get back onto a traditional Medicare. And so if you're on traditional Medicare, and if you're already happy and satisfied with your Medicare supplement, that's also something that we do 12 months out of the year, because those do not have a designation period. We help folks save their retirement dollars and lower down their premiums. Especially the most impactful one that we found throughout the years is Medigap plans. So if you're seeing your rates increase, please don't hesitate to give us a call. Take care, and God bless.